There is a first-of-its-kind new place for people in Maine to get help with either drug or mental health crises. It is Maine's first crisis receiving center, and the state hopes it can be a model that it can replicate across Maine.
6 years. It has been quite some time that we've recognized that our behavioral health system was crumbling.
Hospital leaders say the emergency department is not the best place for people dealing with substance use or a mental crisis.
And we need to do better as a state to meet the needs of this population.
That's cool you get it done in 1 year, though.
Enter Maine's first crisis receiving center, a partnership through DHHS and Spurwink.
Other than the emergency department, we didn't have a place that you could go if you weren't feeling safe or comfortable in your own home. We're a place for people who are experiencing a crisis, and whatever that crisis means to you.
This so-called living room crisis center has an intentional design, a central area for meeting with staff, coffee and snacks, bathrooms with showers and motion sensor lights that can alert staff if someone has overdosed.
If somebody's not moving in the space, the light goes out, we know that we need to go in. Nobody could come in and bother you. Only staff could get the door open.
Badge entry private rooms.
A couple of chairs, love seat, table. The idea is that if you need to take a nap, if you need to rest, you can put the chair and the love seat together and have a nice time.
Laundry, and eventually room for people to get medication.
Once we're up and running 24/7, we'll have 24/7 access to emergency psychiatric meds. So if somebody comes in acute withdrawal and is interested in starting medication-assisted treatment, we're going to be able to do that. We're also able to access emergency antipsychotics, things of that nature for folks that are really struggling.
All of this in between two of Portland's most often accessed shelters and resource centers. In the first 2 weeks during the center's soft launch, they've already seen clients turn success stories, thanks in part to law enforcement tapping this new resource.
If the police pick up somebody and they think it's more appropriate to bring them here than to jail, we'd really love to have them here.
This low barrier option, no insurance needed, is a unique opportunity, facility leaders tell us.
That anybody can walk in at any time and get their needs met. I think that's qualitatively different.
So right now the center at 62 Elm Street in Portland is open from 7 a.m. to 7 p.m. every day. Psychiatry is available from 9 a.m. to 5 p.m. Monday through Friday, but they plan to expand to on-call options on nights and weekends. Eventually, the staff want to be able to run it as a 24/7 service, but right now the struggle is hiring.